If you could see me,
You'd see a young person.
with hopes and dreams like you.
I have a secret.
It's 3 little letters, but it's a hard word to say.
Would you reject me?
Would you tell someone else?
Medicines are a small part of my life.
Would you accept me if you knew?
I'm not contagious, so nothing changes.
We do have a future.
I am fit and healthy.
I do have normal relationships.
If you could see me,
You wouldn't see HIV.
you'd just see me.
Throughout history, stigma towards people who are perceived as being ill is pervasive. Leprosy, for example, was considered divine punishment exacted upon people who were sinners, dirty, and not worthy of religious society. Similarly, in the early years of the Industrial Revolution, people who contracted cholera were stigmatized as lazy and vice-ridden. Stigma, according to Brown et al., can be understood as a mark of disgrace, shame, or dishonor associated with a particular person, quality, or circumstance leading to a diminished social status and often the violation of human rights. Today, despite the role of modern science in disproving perceived links between disease and divine intervention, stigma almost always exists around people with certain illnesses, almost always making some assumption about the sufferer's character based on their diagnosis. In the case of HIV and AIDS, this is no different. The human immunodeficiency virus, HIV, is a viral infection spread through the contact of bodily fluids, such as blood and semen, that attacks the body's immunity, eventually leading to an inability of the body to stave off secondary infections. HIV/AIDS is a highly stigmatized virus because contraction of the virus is often linked to unsafe sexual practices and drug use, although these are not the only ways in which the disease is spread. In a study conducted by Herrick et al., comprising a sample population of 10,000 Americans, 2 in 5 expressed that they feared people with AIDS. Furthermore, 1 in 5 of these participants agreed wholly with the statement that people who got AIDS through sex or drug use have gotten what they deserve. The source of these perceptions stems from the common association between the contraction of the disease and sex or drug use. Consequently, people with AIDS are often seen as being sexually promiscuous, having loose sexual morals, or abusing drugs. However, the spread of HIV is far more multifaceted and is a social issue which is exacerbated by stigma, which pushed HIV-positive individuals to the margins of society where they cannot or feel they cannot be helped. In South Africa, where HIV/AIDS affects more than 6 million South Africans and more than 140,000 people will die due to the AIDS-related causes, the stigma represents a significant social health issue. This is because stigma discourages people from being tested regularly and increases the likelihood of them unknowingly spreading the disease, and secondly, fear amongst HIV-positive people of being found out and shunned by their community discourages the seeking of medical help and treatment. Those who have had experience with anyone or anything HIV-related are likely to exhibit lower levels of stigma related to the virus. Socio-demographic factors such as gender, age, marital status, and education also play a role in how stigmatizing an individual or a community will be towards HIV and those affected by it. South Africa is particularly multicultural, and certain cultures understand HIV and AIDS differently to others. Therefore, culture plays a large role in the intensity and nature of stigma related to HIV. Research has shown that voluntary HIV counseling and testing programs reduce high-risk sexual behaviors and can decrease rates of sexually transmitted infections. A study conducted at the University of Limpopo showed that the 2 main barriers to HIV testing were fear of test results and the potential consequences, which include stigma, disease, and death. The study found that the stigma related to HIV was the largest barrier to HIV testing, particularly in rural areas. Stigma affects the way in which many people orientate their behaviors and attitudes within social functioning. This can lead to the disruptions in the views of society. This in turn affects the real experience of HIV and AIDS within communities and is often seen as a dismissive subject. People like to distinguish, label, and box things that are foreign to them in order to associate negative attributes to a particular type of person. Communities that are perceived to be more susceptible to the disease are based on physical criteria, type of work, and even geography. Therefore, a stigma and social hierarchy is created to legitimize and perpetuate social inequality. This is because people believe it would be a harder disease to catch if it occurs in circumstances that you are not associated to. So people have formed a fear of isolation around HIV and AIDS, and this prevents them from seeking medical advice or treatment. Many of the youth of South Africa are scared to use condoms because of the connotations, implications, and associations that are associated to condom use. Therefore, people would rather avoid being tested because of the fear of judgment within their social community. In terms of intervention, campaigns targeting the reduction of HIV and AIDS stigma have focused on key areas, namely education and the provision of support. Additionally, these interventions seek to support HIV-positive individuals by providing pre- and post-test counseling, as well as long-term counseling to help individuals cope with the possible psychological effects of living with such a stigmatized disease. At Rhodes, for example, these kinds of interventions are evident, namely in the routine testing on campus and the supportive testers by the counseling center. But what did people have to say?
It's not really comfortable testing in the tents because everyone is outside waiting in a queue, and then the next thing you go in there and then you don't know the results, and then you're coming out, everyone is like looking at you.
Personally, I feel like people aren't conscious enough. Not many, from how I see it, not many things are being done to raise the awareness on HIV on campus, yeah. And then it's only upon personal conviction that you go and get yourself tested and be watchful of what you're doing. But really to say that things are being done to raise the awareness, I haven't experienced any.
Amongst the people that I find myself surrounded by, it doesn't exist. But also, interestingly, it's not something that is on regular topics, so it's not something that we tend to discuss a lot. But I know very clearly that the consensus is that there isn't a stigma towards it, that it's a real pandemic that we need to figure out how to help aid as opposed to sort of like marginalize.
South Africa has been identified as a country with comparatively high levels of HIV and AIDS education and awareness. However, stigma still remains a prominent issue. The effect of this is to further push these individuals to the margins of society, again, where they do not have access to proper healthcare or testing facilities. Stigma, therefore, is not only a prominent social issue that causes oppression and discrimination, but it also represents a significant public health issue because of its effect on testing behaviors.